give it a second. All right, cool. So hi, everyone. Welcome to today's community call, where we'll be kind of talk about or show everyone the work group updates. So here is the agenda for today. So first, we will share kind of a quick news, and thank you so much for everyone who participates in the ETL tutorials 2 weeks ago, and also kind of help spread the word and promote the event, which was a huge success. So we will kind of briefly go through the materials and decks which is available, and then we'll go into the main part of today's community call. It's the work group updates for the following 4 work groups: the Oncology one, Psychiatry work group, UK Biobank/Registry work group, and also the EHR Electronic Health Records work group. So with that, I will quickly share that since we had the ETL training on August 12th and 13th, we had I think 140 registrations, and then we had for attendees we have around like 60 to 80 something attendees, because it was a 2-day event, so kind of the attendance varies a bit, but definitely we had a huge a group of people that joined the ETL training, and we had a lot of interactions. I think that was a great turnout. And now all of the materials and recordings have been updated, have been uploaded to YouTube, and also it will be online soon with the link I've shared here, that you'll see all of the slides for day 1 and day 2, as well as all of the recordings of the lecture part on the website as well. So I think if you're interested, welcome to kind of rewatch or download the materials again to your laptop, so you can kind of have a review. And please let us know if you have any further questions or suggestions. And we do appreciate all of your feedback on filling in the questionnaire or the survey for the training. And if you have not, please fill in the survey, which is also in the APAC, OHDSI APAC teams. So with that, we will we'll be playing the work group updates from the global community call on the 4 work groups. So with that, I will share my screen.
Everybody, good evening for those of you joining from other time zones. My name is Shilpa Rathwani. I am with IQVIA, and within the OHDSI community, I coordinate the project efforts for the Oncology Working Group. Today I'm going to be talking about what we've accomplished in 2020 and what the plans are for 2021. You guys have seen this probably before, and this roadmap has evolved.
We can see the video.
On behalf of so many incredible and enthusiastic people who contribute to this oncology working group and have gotten us to this point in the roadmap.
We cannot see the video.
Module and vocabulary. So if you imagine a cancer patient's journey through the course of the disease, this is how it might look like.
Yeah, Jing, we are still looking at your slides. Hello, Jing.
I think she's working on to fix this.
Hi everyone, can you hear me? I think I just
Yes.
uh,
Yes.
I don't know why, like my meeting was just closed. Let me share again. I'm very sorry about that. Let me share again.
Rima and Michael, Andrew, all of them came together. We scoped the roadmap of our effort to be able to represent the journey in OMAP. And this is how we ended 2020 and started 2021. So just a high level recap of what we've covered in 2021. So from an oncology module and vocabulary perspective, we extended the OMAP representation of diagnoses to include multiple diagnoses, modifiers that uniquely define cancer diagnoses and determine patient prognosis and treatments. We integrated several specialized cancer vocabularies into the OMAP vocabulary, including ICD-03 and NACER. We completed work on diagnostic cancer attributes by bringing together and reconciling clinical and pathological data for major cancer standards and vocabulary, and created one unified cancer vocabulary. Somatic mutation from 4 major genomic databases and 3 vocabularies were integrated into our ontology. These include variants at the genomic level, protein level, transcript level, covering deletion, insertion, substitution, translocation. And this will support analysis of tumor biomarkers. So we're very excited about this. In the episode model this year, we added designated episode vocabulary and conventions for defining episodes. So we represented the confined disease, invasive disease, metastatic disease in the episode table, thus enabling answering questions like time to metastatic disease. The vocabulary-driven ETL that was implemented back in 2019 from the tumor registry to OMAP, in 2020, the ETL was productized and used to transform tumor registry data for participating institutes, MSK, Northwestern, IQVIA, Columbia 5, actually. A subset of the OMAP converted data was used in the COVID cancer research studies as well. There was a lot of interest in the oncology module, so to help adoption of the model, we held oncology workshop in Europe, which was back in March. And then we had the symposium, which had tremendous attendance. We had a tutorial, a 2-day tutorial for the US and Asia Pacific time zones. And our publication, we worked on a publication that was accepted and now is in print in the Journal of Clinical Oncology. So it was a paper for extending the OMAP common data model and standardized vocabulary. And then there was also a publication in the JMIR. So there's been a lot of activity even outside of the work group in the community in terms of adaptation and dissemination. All of this work allowed us to answer some research questions in a distributed OHDSI research network. A study package to inspect treatment patterns and outcomes of patients with metastatic bladder cancer was developed and executed on partners like MSK, IQVIA, Columbia, Tufts, Aju, and Northwestern. So that was 2020. Thank you to everybody that was part of that, that tremendous work that the work group did. And we have bigger plans for 2021. So in 2021, we're actually looking for funding. We need to do a lot of work. Of course, this is a large, huge space, oncology. So there's a lot of work still remaining for us to be able to address the problems of standardizing knowledge representation, harmonizing the data. We're going to be needing to build a knowledge base of clinical ontology and also build a crosswalk between existing ontologies like NACER, AJCC, CAP, ENCODE, Oncology, etc. And then we also want to address the problem of aggregation by developing and validating data conversion process into OMAP. There's also some algorithm work, some abstraction work that we want to take on because of the disparate nature of the source data and meeting the challenge of actually making this data available for oncology, the oncology module and vocabulary. So there is IRTC grant out there that we're looking at. We're currently challenged with coming up with a PI. So if there's anybody out there that's interested in helping us out, please feel free to reach out. The episode model that we built last year, there's a lot more work that needs to be done on that. It is a little bit of a iterative effort. So we got some feedback from the recent implementations of the disease episodes. So we need to come up with some rules around creation of the disease episodes for capturing the overarching disease episode, the extent of disease, how far the cancer has spread, the status of the cancer, whether it's stable, remission, progression, etc. So there's work happening in this area as well. And then, the regimen algorithm detection that we built last year, we also want to enhance it. We want to do enhancements on treatment patterns and treatment-related outcomes like time to treatment discontinuation. We did a process of validating our assumptions that we're making to capture real-world treatment patterns. So some things have come out of that. So there's enhancement work that's needed. And then, of course, the adoption continues. We have planned for two tutorials this year, more than 2 tutorials, and additional data partners that will bring their data and contribute to converting to the oncology module and also the genomic module, because that's also in the initial stages of us actually validating whether our module and vocabulary can answer questions, at least some questions to begin with. And then we're also integrating with other prominent entities in the oncology, precision medicine, and genomic data harmonization space like Oncology, Genie, VIC, MCODE, Nebraska Lexicon, HL7. We also work very closely with HEMONC. They provide the ontology for drug regimens, and they're working in parallel with us to build upon their regimen ontology. So they obviously respect the work that the OHDSI community does, and they're willing to take our input and do some of the background work for us. And then, of course, we're also continuing to run the studies. We're collaborating with additional data partners on network studies related to cancer burden, characterization, treatment patterns. We also have a bladder cancer study execution that's going to start with University of Colorado. And then there's a liver metastatic study that we're piggybacking on the study that we did for the bladder cancer and extending it. This is for a collaborative effort between NIH and University of Alabama. Some initial discussions on NLP works to extract cancer-specific data from text has also been ongoing. We'll have more to share in the future. We obviously continue to look for support and involvement from the community to contribute towards this incredible work that the oncology working group is already doing. So if there's any interest, this is very exciting work. Feel free to reach out. All of our information is up on the OHDSI wiki page. That's it from me.
All right, cool. So that's for the oncology workgroup update. If any questions and comments before we go to the next working group?
Welcome to today's community call, which we are calling Back to School and Focus.
All right. So with that, I'll go to the second workgroup update. That is for the psychiatry workgroup.
Psychiatric working group we started like in late 2019, and So most of the work was done in 2020. So we added, we started work on psychiatry vocabulary, which is represented from Psychiatric Scales. There were a couple of use cases where people have the scales in their patient data, and we didn't have any equivalent in OMOP. So we decided to add those scales. So here is the example of what we do have in Athena. So there are about 200 of scales added. And for psychiatry, there is no measures like lab tests, or there's pretty little of them. So to make some objective diagnosis, we use these questionnaires, scales, and inventories. And this work was done as a collaboration of several organizations like Aju University, SMINDU, University de Lille, and Akrivia. Also, there was involved with N3C NLP group to understand patterns in the scale data extraction process. So not only vocabulary was we worked on, but also we worked on external validation of model prediction bipolar, misdiagnosed as MDD, and also we validate machine learning model predicting new diagnosis MDD patients. MDD stands for myocardial disorder, within 1 year after initiation of beta blocker for cardiovascular disease. So the idea is that pretty often, sorry about the first study, pretty often bipolar is misdiagnosed as MDD. So using those prediction model, we might raise awareness of clinicians, like which signs should be looked at and when the signs can be predictors of MDD. So this was validated on different, and what's interesting, it was validated on different countries, like it was Chinese data set, was US data sets, and in all different data sets it worked. And in this year, we continue on both vocabularies and studies. So on vocabularies, we want to, explore the scales topic and looking at the content, like what's normally added or what use cases are added. And also we think of another structure. So instead of having, and actually this work is going outside of just psychiatry working group, it will affect all OMOP, because this is how we are going to represent measurements. Instead of just variable value pairs, we want to put them as a one concept. Like here, you can see that we have RAS scale, and it has their values from -5 to +4. And instead of putting this in a measurement as a variable value pair, we actually already made those concepts. So for RAS score is just a pilot. We give only one concept, which represents this particular condition. The patient has some condition standing for like RAS scale +4, meaning patient is combative. And thus we can build a hierarchy for that condition, and also it can be easier when you build the concept sets. As you know, when you populate values in Atlas, you can't put concept sets there, right? You put just one by one. And in this case, we create this vocabulary structure. So you're able to put all, let's say if you want to find all combative patients, regardless of what measure was used for, you can create concept sets of those measurement concept ID with standing for combative. regardless of whether it was measured by RAS scale or it was measured by some other behavior inventory or even doctor's clinical assessment. So we're working on this measurement domain changes, and I don't know, probably when we will get a nice proposal, we can come up to a bigger group. For example, we can make, in a CDM call, we can make a presentation of that. So it's work of psychiatry working group and vocabulary team together. Okay. Also, we continue work on vocabulary, not only the scales, but also looking for other vocabularies like DSM-5 and how it should be added to OMOP or not. Yeah, and also we want to collaborate with other groups. Want to find funding. So one of them is RDoc framework. So we looking at what are their metrics and how and what are their grants, and whether we can help them with these metrics and whether grants we can apply to that. Also network studies. For example, now we have this surveillance study, and as far as I understand, it's still ongoing. So if someone wants to join the group, join the study, you're welcome. And also, we continue exploration of NLP effort to extract psychiatric codes from unstructured data sources. Right, so it's another source of use cases, and that's it. So you're welcome to join and be a part of the team.
All right. So, because I know there are several kind of psychiatry related studies that we've talked about, so welcome to join. And I want to quickly mention that all of the working group can be found on the website, and I will share the links in our chat as well. So next we will go to the biobank and UK Biobank and Registry Workgroup Update.
Working group. It's a bit of an unconventional working group in the sense that we're focusing on one particular data set. But we actually tackled some very generic mapping challenges as well. So how does this all start? It's a bit of an unconventional short post from Patrick to ask, is anyone interested in mapping this data set to the OMOP CDM? And this got a lot of attention. Seen from almost 40 replies to this thread. And then start of last year, this dataset was actually selected for rapid data partner call from Eden. And then Spiros took up the glove to kick off a working group around this. So our objective was really to align the parallel UK Biobank to OMOP conversion efforts, to share information and discuss these challenges. So there are actually multiple teams working on these conversions. Regeneron and Odysseus partnered up. The Hive company I'm working for, we partnered up with UCL. And there were also members, people from NIH, the University of Zurich and Oxford, all chipping in on this, working on our own ETL process, but sharing progress updates and discussing common challenges and capturing the resulting conventions. And we actually captured that in on the Odyssey forums, for which I will show some examples. Maybe first, very briefly, if you haven't heard about UK Biobank, what is it? So it's a big survey from the UK mainly built around this baseline data and a large questionnaire and recruitment for around 500,000 persons. Almost 5,000 variables were collected, both from questionnaires, but also from lab data measurements, and also multiple visits at which these data points were collected, resulting in quite a big data set. I'm showing synthetic data. This is, but you get this whole wide table with a lot of different question answers pairs. You already see the challenge of mapping this. It's great. There's a great documentation for this. I won't go into detail, but yeah, just to show a bit what kind of different variables are in this data set. Besides this baseline data, the data is actually also supplemented with hospital EHR, primary care data, cancer registry data, and data from a death register. And those data types are actually less challenging. The main challenge was in this baseline data I just showed. Okay, so a brief walkthrough of our achievements in the last year. We actually had our first meeting in February last year. And what we started with is by prioritizing just these variables to map and to understand the complexity of the data. And this is initial draft of our approach, not the final approach, but this is how we began understanding the data. Then we identified some challenges. One of these was that there were a lot of history of condition questions in this survey. But sometimes we had an age or a year in which this history occurred. So, how can we capture that information? And that resulted in this more detailed history of concepts. A history of a condition within the last 10 years or within the last 3 weeks or longer than 5 years ago. And this was added to the OMOP vocabulary. Then we also dig into the how to map these variables. And this resulted in a proposal for a wide source to concept map table. Actually work from Christian Reich came up with this proposal. I don't think it's yet that standard. This thread is also still ongoing. Then, of course, we want to add this vocabulary, all these fields, variables, to the OMOP vocabularies, at least as source concepts. And there, the team from Odysseus, especially Alexander, did great work first figuring out what is this whole structure, and this resulted in an actual release of the UK Biobank vocabulary in OMOP. There are over 18,000 concepts, and this also includes some initial mappings to standard concepts. So, of course, greatly aids in the mapping process itself. A minor thing we discussed was how to use the type concepts. We have quite a lot of different types, from hospital data, so the EHR, from registry, patient field survey, healthcare providers field survey, and these all represent different levels of trust in those records. So you get a convention on for what data source we use what type concept. And of course, most importantly, in the end, we map this UK Biobank data to the OMOP CDM. Just some screenshots of a run on a subset of the data. So this is actually now largely finalized. People from Regeneron are now talking, or actually, I think also IQVIA is taking this up. Talk with the people from the UK Biobank group to see how to publish this data. But what then is the future of the working group if the work is done? Well, a logical continuation is to broaden the focus in general to registries in general. And we've seen already quite a lot of interest on that in the Oncology forums, both from last year, but also very recently from John Duke. And this would then be something similar to what the clinical trial working group and the EHR working group are doing, and making conventions around a particular source data type. So that's our proposal. So yeah, data types could be CRF-driven registries, or actually registries extracted from real-world data, from EHR data. We're currently on a 3-monthly schedule. Next meeting is the 21st of May. So if you're interested, please come and join. And one of the first challenges would be to look at the wide format data of answer value pairs. And we already need your input there because Christian actually already kicked off a thread on that without any replies yet. So please take a look if you have an opinion on this. Christian thoroughly sets out all the challenges in here on how to map these variable value or question answer pairs to the OWASP data model. Just to explain, there are multiple scenarios there. Either the pair maps to one concept, could map to a observation concept and a value concept, or to a value as number. So how to tackle this? Well, this is something we tried in this biobank mapping, but it would be good to make a general convention out of this. So to conclude, if you're interested in a registry working group, please let us know. I'll share the slides and go to this OHDSI forum thread and add your use case, why you're interested, what particular challenge you want to tackle, and then we'll hope to see you in the next call. Thank you.
All right. So the next, we'll share the last of the 4 workgroup update, which is the electronic health record.
All right. This is Melanie Pulaski, and this is the Electronic Health Record Working Group May 2021 update. So these are objectives and results for 2021 is to provide support for the transformation of source EHR data to the CDM, so OMOPing your data. We also discuss and provide guidance on CDM logic and conventions. Also, whenever the CDM vocabulary workgroup has a new proposal for changes to the structure of the vocabulary of the CDM, we also discuss those and provide the feedback. We're here to help each other learn from our experiences, and we also discuss any other OHDSI CDM or electronic health record topic. So our first key result is an up-to-date educational and collaborative resources on the MS Team site for those OMOP their data to the CDM. We haven't started this yet, but it does include procuring and maintaining a list of OHDSI and OMOP ETL educational materials. Currently, they're spread over many different things between the Book of OHDSI and course. So we would like to put those in one spot. I would also like to establish an OHDSI member-to-member support network or some type of mentoring program. I think this is very important, especially for EHR data that's coming from certain vendors. If we could connect people that have ETL their data from Cerner, Epic, any of the big names. There's a lot of people out there that have done this work and can provide some guidance. So setting up a mentoring program, I think, would be very helpful to the new folks coming to the community. And then also creating a guide of published or presented work on others' experience mapping EHR data to the OMOP CDM. There's been a lot of, many people have published or presented their work, especially for the OHDSI Symposium. So I think having that all in one spot where it's easily searchable on this particular topic would be helpful. Our next key result is we review all the CDM and vocabulary changes that the CDM vocab workgroup puts out. And this has been in progress and continuously ongoing. So we actually just discussed last week during our meeting the proposal for CDM version 5.4, and we're prepared to give feedback to the CDM vocab workgroup on the proposal. And then next, key result 3, to identify the knowledge gaps and then invite subject matter experts to present at our session. This is also something that's in progress and will be continuously ongoing. And we identified those knowledge gaps at the beginning of the year with a meeting poll that was completed. And from there, that informs us what the different topics will be for the year. And so far, we've had Christian Reich present on the wide mapping table last month, or 2 months ago now. And then in the future, we are going to join the clinical trials work group to get an idea of what they're doing and how the clinical trials in the EHR, where they intersect, especially during like ETL and the different data points that we have. Christian Koska is going to present drugs for research in July. Claire and Frank are also going to give us updates on the data quality dashboard over the past year. We don't have a date for that yet. And then I've also reached out to other folks about presenting for our various topics this year. Another thing we do is we also provide open discussion meetings on a regular basis so that the OHDSI community has an opportunity to bring new or urgent topics up for discussion. And we pretty much have one of those meetings. So far, we've had in February, March, and April. And we continue to provide that on an ongoing basis throughout the year. That is us and what we do. We meet every other Friday at 10 a.m. Eastern time with our next meeting on May 14th. And you can find us on MS Teams as the EHR Working Group, OHDSI.org, the wiki, the project, the work groups. You can find us there. You can also find us on the forums if you search EHR data to OMOP CDM Workgroup. Or you can email me, Melanie Flosky at odysseus.incorporated.com. Everyone is welcome to our working group. Come join the journey. Thank you, Craig.
All right. So that concludes all of the 4 work group updates. So any questions or comments from the audience? Cool. So with that, I think we'll give everybody 17 minutes back, and please stay tuned for our next community call. So we'll be talking about running network studies, how to run it, and also kind of the bits of the steps, and we'll be answering all the questions you may have as well. So thank you all for your time.
Thank you.
Thank you.